Appreciate it. And Jean, thank you so very much for, first of all, having this series and for inviting me to be a part of it. I don't know if you all in Highlands realize it, but this truly is groundbreaking that you all have had the opportunity to look at so many different aspects of financial sustainability. And you probably already realize this, it's part of the reason that you're here, that church benefits can be the second largest budget item for you, behind, of course, salaries. Some churches have building expenses that might be a little bit higher in years that you're doing capital work, but it tends to be that benefits are going to be your second largest expense. So we want to make certain that we're maximizing for you the ability to be good stewards. We are covering a ton of information tonight. I want to give you an overview of the flow of what you can expect. And I want to encourage you, as we were talking before we went into the prayer today, we were talking about asking questions. Anywhere along the way, Jean has asked you to mute, but I want you to go ahead and populate the chat. She and I have done any number of these financial seminars together over Zoom, and she's really good at poking her hand up and saying, "Hey, Carrie, there's a question here that's applicable to this." So if you've got questions along the way, please pop them into the chat. If you find that you're in a situation where I'm saying something and you really aren't getting it and you need to say, "Hey, Carrie, stop," I am okay with your unmuting yourself and doing that, and we'll see what we can do to address that question. So please make this interactive. I'm trying to keep as many of you on my screen as I can, but I can't see everybody because we got great attendance tonight. So speak up, unmute yourself if you need to. What I'm hoping we're going to cover tonight is to give you a little bit of a reminder of who we are and why we serve those who serve the church. We're going to cover a section on what's new in 2026 as the rollout of the rewrite of the 2025 benefits plan. We're going to go through plans and programs that we offer in the four main categories. I'm going to show you those. Then we're then going to jump into the value added that we have through our assistance programs and our education offerings. And then finally, I'm going to remind you that employer agreement season is happening now. Jazz hands, everybody. Employer agreement season is up. Started last Thursday. We're going until October 3rd. So please pay attention. And if you are not the employer representative registered with us, please feel free to ask questions about how to become the employer representative or what we can do for you. Does that sound like a good thing for folks? Excellent. I appreciate the thumbs up along the way. Let's get started, folks. So what we're looking at is the Board of Pensions has been around for 308 years, as you know. We were one of the first entities to be granted a charter by William Penn's sons. 308 years. We've always been located in Philadelphia. We are the church. In 2015, when the Reverend Dr. Frank Clark Spencer started as our president, he looked around and said, "This is excellent history. We are fabulous, but we need a theology of benefits. Why do we do what we do theologically?" He gathered a really smart group of people in a room and said, "Write me a theology of benefits." Now, these were pastors, and you know pastors, we are verbose. They said 20 pages or 200 pages. And he said, one page, one page, one page only. And they said, "Can we have footnotes?" Well, that one-page theology of benefits does have footnotes, tons of scriptural citations, but you see in this paragraph sort of an encapsulation of what we're trying for and this wholeness and flourishing in life and in ministry. So we've shaped all of our plans and programs around these pillars of wholeness, spiritual health, financial, and vocational. And we're trying to make certain that we stay connected. We are the connectional church, reformed and always reforming. And that's why we're gathering here tonight, because this presbytery-wide effort will be a pilot, is a pilot for which we're hoping something will become nationwide an opportunity for PCUSA connected churches to help with financial stewardship. Really important. So we're excited about that. Now, having a theology of benefits allows us to slot into what the IRS calls as Section 414E of the Internal Revenue Service Code. We are a church plan. It means that what we operate is defined for us, for the service of our member churches and for those who affiliate themselves with the PCUSA. And what does it do? It means that all of our benefit offerings can be done in such a way that we are living out our values. living for you. We serve those who serve the church. So I'm going to be talking in a New York minute because that's my heritage. But if you need me to stop, I want you to hear this one thing. This one thing. We are here for you. We are truly here for you. You've got questions, we're here to answer them. If I can't answer them, my team can. If you can't reach me immediately, 1-800-PRES-PLAN, 1-800-773-7752. I know Jean's going to throw that in the chat for you. We are here for you. So here are our benefits packages. This is what was the new lexicon that we threw at you in 2025. 3 new phrases for your lexicon. The first is this, the covenant package. This is the thing that offers financial protection to anyone serving a PCUSA related entity for 20 or more hours. This used to be called Minister's Choice. It is now called the covenant package so that anybody, regardless of ordination status, can have access to it. And it offers all of these things that you see in it. I'm going to jump up and down about this eligibility thing because if you have a sexton, a church musician, an educator, anybody who's getting a W-2 from you for 20 or more hours a week, please think about having the covenant package. Why? Our pension is unequaled because of our experience apportionments, because of the fact that we have excellent asset over liability commitments, because of the ways that we have pension credits being earned for those who are at less than median effective salary can earn pension credits at the median. Our pension is unequaled. You couple that with our death and disability offering, which is again unequaled. Somebody gets disabled and they get past 90 days, the board picks up the benefit costs, even if you have to let that person go. Unheard of protections for just 10% of a person's effective salary. So please consider the 2026 costs for the covenant package, aka used to be Minister's Choice, is still 10% of effective salary. Now, the covenant package, as you can see, has this eligibility, has these maintained. This is not something that you can cost share. Remember, I told you that we've got 3 new phrases introduced into your lexicon. The covenant package was the first of them. The covenant package is a component of the next 2. That 10% is a component of the congregational pastoral leader package and the transitional pastors package. Covenant package, CP if you want to put it shorter. The congregational pastoral leader package, CPP if you need it shorter. And then the transitional pastors package, TPP, if you need to make it shorter. Covenant, congregational leader, transitional. So covenant package is built into the congregational pastors package. It's essentially the congregational pastors package minus medical. Congregational pastors package, which meets the book of order requirement for what has to be given to somebody who is installed. The congregational pastors package is that income protection package plus member-only medical. And as you can see on the slide here, it's for 2026, 17.5% of a person's effective salary. It was last year's 16%, but because our United States healthcare system is broken and costs are always going up, I'll get into that a little bit later to show you some of the reasons behind it. We're taking it to 17.5% of effective salary. We're still subsidizing heavily, and I'll also cover that for you in a moment. This congregational pastors package can be coupled with dependent coverage. And Jean in a moment is going to talk to you about what Highlands expects, but as far as what the board expects, the congregational pastors package is the covenant package of income protection and member-only medical coverage. That satisfies the book of order. Dependent coverage is available and can be cost shared if one is not installed. What are the costs? These flat, national, community-rated, fixed pricing offerings. As you can see in 2025, you see the numbers. And many people said to us in 2025, Carrie, the children and the spouse don't equal up to the family. You're right, that was by design, because those were the actuarial prices of dues in, claims out. That's what our actuarial tables and pricing said. Because so many people were confused by that, you'll notice that the 2026 pricing has the children amount and the spouse amount equaling the full family freight. Okay, 99.50 plus 12,250 does equal 22,200. That is what it costs to add the full family coverage to the pastors only, the member only pricing for the congregational pastoral leader package. Now I'm going to give you an eye chart on this next one, but I want to do this for a reason because I want to highlight to you how we are still subsidizing things. As you look at the pricing for dues, I want you to recognize that there are minimums and maximums. And the minimum column, where my cursor is, if you're able to see that, sorry, I didn't mean for that to go forward. The minimum column, if you look at the member only 6,500, the subsidization there, if one were to price this actually, that member-only medical coverage annually should cost $12,500. So as you can see, we're subsidizing even that offering by $6,000 annually. Now, I want to also direct your attention down below it to the member and family minimum price of $28,700. The actual pricing for that to cover a full family should be $34,000. So again, we are subsidizing that by $5,300. It's really important to recognize that we are building this in so that the community can have the mutual care for one another and the flexibility to get exactly what you need. That's the point of the Congregational Pastors Package. Now, if one has chosen to stay in what was the traditional pastors participation plan, these are the transitional pastors participation rates for 2026. Somebody coming out of 2024, chosen 2025 to be in transitional pastors participation, it would have been for these 33% for medical, and then you would add the 10% as a component of the TPP for that total of last year of 2025 being 43% of effective salary. And for next year, 2026, the total will be 47% of effective salary for the 37% medical and the 10% income protection. Now, I want you to take a screenshot of this one, please. And in particular, please note the web address, pensions.org/decision-guide. And the reason for that is as you are doing your budgets, please, I know tons of people have excellent Excel spreadsheets. You got to see my husband when he's getting his Excel spreadsheets going. So much fun for us to have warring Excel spreadsheets. Don't use them for this. Because there are minimums and maximums, it's so much easier for you to go in and use the calculator that we have built in. You'll see that on the left of this screenshot, there are some metrics and gates that you have to get through. I've triggered this one for 2025. You'll notice that the calculator can be set up for 2025 or 2026. And I wanted you to see in simple math, I've put in an effective salary, $100,000, so you can see how this works right now. So together, as we look at the comparison between Congregational Pastors Package and Transitional Pastors Participation, if you're trying to discern what is more cost effective, what is the lowest cost option for what you're trying to flexibly offer to your pastor, you put in the $100,000 and you'll see that pension, death and disability, and temporary disability is identical across those two package offerings. CPP and TPP have pension at $8,500 because it's 8.5% of the effective salary. It has death and disability at $1,000 because death and disability is 1% of effective salary. And it has temporary disability at 0.5%, $500, 0.5% of effective salary. You add those percentages up, you get 10% of effective salary for the components of the covenant package. And oh, by the way, for those of you who remember Ginsu advertisements, but wait, there's more. We throw in the employee assistance plan to the covenant package and to CPP and TPP. We just don't charge you for it. Three components of the four components, the fourth free of covenant package, and then you see medical member only under CPP. In 2025, as I shared with you, it's 16% of effective salary, aka the 16,000 that you see here. And then you can't see it on my screenshot, but if we were on the actual website, one could toggle what kind of dependent coverage you wanted. Member only, none. Children, one or many bambinos, we don't care how many. It's all the same flat price of $89.50. Spouse, hopefully there's just one. That's 11,000. And then finally, family, it's at 20,600. And yes, as we've talked about, the two numbers do not add up for 2025. They do for 2026. At the bottom of this screen, sorry, at the bottom of this screenshot, it's not as clean as I would have liked it to. I wanted to show you as much as I could. It shows the employer net cost. If it were just member only at 100K, it's clearly a lot more cost effective at 26,000 to provide the pass-through the package than it would be for full family medical coverage under TPP. That's why this medical is $33,000. Okay. That is the 33% of effective salary is what TPP would have cost for full family medical. Now I'm going to pause there for just a second. Jean, do we have any questions in the chat, or am I New York minuting okay? Nope, looks good. Anybody got a verbal for me?
No, there's no chat.
Excellent. So Jean, I'm going to encourage you then, while we're on this decision guide, one more slide, and then I'm going to encourage Jean to talk to you about what your excellent Committee on Ministry has discerned for the Highlands guidance. The reason I want to show you this next slide is so that if you're trying to figure in your brain what is the tipping point or the break-even numbers at which TPP is more cost effective or CPP, this little chart, again, I'm going to encourage you to take a screenshot of this. And oh, by the way, everything has been turned into a PDF. Jean has this PDF, so you don't have to take a ton of notes, nor do you have to take a ton of screenshots. She's going to put that PDF on the website and make that available to everybody very shortly. But for your immediate purposes, go ahead and take a screenshot of this so that you see if somebody in 2025, for example, was earning less than $113,939 and needed member and family medical coverage, then it would have been better for them to be on TPP at lower. And if they're earning more than that, better to be on CPP. That's how this chart works. Lower than the number or outside of the bounds under member and children, then you want to be in TPP. Above the number, you want to be in CPP. I'll pause for questions and for Jean to talk to you about what Highlands COM has decided.
Okay. You will see I just put in the Dropbox, in the chat, a link to the Presbyterian. This is for the Highlands Presbyterian, not all of you from Highlands, but our requirements for the Board of Pensions for next year. And actually, for those of you who knew about it last year, it is the same. We did not know how things were going to change, so we just made the policy for 2025. We've reviewed it. I reviewed what Board of Pensions has published, and it will be the same, meaning that installed pastors have to be in the, I always get this, CPP, the Congregational Pastor package, and the family and spouse have to be covered. Now, if the spouse has employer provided insurance, they don't have to cover the spouse. So a lot of it depends on that, but it has to be where this doesn't cost the pastor additional money, out of their own salary or out of their salary, their and spouse's salary. So we call it budget neutral. So it's the same as last year that they have to cover. Now, there are some creative ways to do things. We know that spouses may be retiring, or they may have military pensions or military coverage or those kind of things. And so if if you kind of you kind of fit a little outside of our requirements, we do have a team from the COM who you can chat with, someone from the personnel committee or session, and the pastor have to meet face to face or Zoom to Zoom with someone from COM, and they can give you an exemption and tell you how to report that exemption on your terms of call worksheet. Does that make sense to everybody? Okay, no questions. All right, we do have one question. What's the difference between a CPP and a TPP? Uh, Carrie, can you answer that one?
Absolutely, be happy to. So, Congregational Pastoral Leader Package is that which provides choice and flexibility and has a different pricing structure, percentage-based pricing structure, Congregational Pastoral Leader Package, versus Transitional Pastors Participation, which is as pastors' participation used to be sort of an all or nothing, one size fits all, full family medical coverage. Some people think that transitional pastors' participation is just for pastors who are in transition. That is to say, they're serving an interim ministry. It's an unfortunate conflation of terms. Think of our TPP design this way. We are transitioning from what used to be in 2024, and we're gradually stair-stepping the dues up in 2025, 26, 27 until 2028, when there will no longer be transitional pastors participation. There will just be the requirement that everybody, every pastor be, every congregational leader be in congregational pastoral package. That TPP heavily subsidized offering will go away. And that's why it's called transitional pastors participation. If you have been in a call and you chose last year to stay in TPP at your church and found it cost effective to stay again in 26 and 27, that's well and good. You can stay in TPP. However, if you are taking a new call or you as a church are employing a new pastor, TPP is not available. CPP, Congregational Pastoral Leader Package, with the flexibility to get exactly what the church and the member require. CPP is the offering for new calls. You can go from TPP to CPP. You cannot, however, there is no structure to go from CPP back to TPP.
Thank you.
So excellent question for whomever posed it.
Another question is, I'm new to this. Effective salary includes man's utilities, etc. Yes. So everything that counts towards your Board of Pensions is considered effective salary. On the Presbytery for the Highlands, now other presbyteries are different. We have on our worksheet what we call above the line and below the line. And right at the top of the worksheet is all the things that if are for effective salary. And then you have a number, and I don't know the line number. It might be like 13 or something like that, Joe. You know that better than I do. But at that line is the effective salary. So it would be maintenance, utilities, housing allowance, salary, and a few other things in there. So that's the effective salary. So that's what it's based on. Someone says we currently don't have a pastor. So when you do get the pastor, yes, the pastor will not be eligible for TPP. You had to be in it in December 31st, 2024. And if you change it, if you're coming into a new one, it has to be CPP, right?
That is correct.
I always get the
That is
covenant and the
correct.
congregational mixed up, but
I know. Covenant package, just think of it as a component. So it's got just two letters. CPP has got three letters because covenant package is a component of the congregational pastoral package or TPP,
okay.
transitional package.
And it's line 10, below line 10. The worksheet, if you're talking about the worksheet I just mentioned, that you can find on our webpage under the COM drop down. We are getting ready. The 2026 worksheet is not up yet because I just COM just approved it last night and I basically ran out of time to get it done, but it'll be there soon. But you can see what it looks like. There's the 2025 is still there. Every presbytery, though, if you're from a different presbytery than Highlands, they have their own way of doing that. So you check with your own COM.
And I will say that in the 16 presbyteries that I serve, from Washington, D.C., generally up along the I-95 corridor to Canada, in those 16 presbyteries, most of those 16 are having a structure that's very similar to the Highlands requirement that the pastor should not be paying additional out of pocket for dependents. Most congregation, most pastorates, most presbyteries are making that same kind of requirement. For the person who asked the very good question about being new to this and asked for the CPP to TPP differentiation, I am assuming a great deal about one's base knowledge. I don't want to do that. So I've dropped into the chat a document. The PLN that you saw is actually our document called Understanding Effective Salary. And it is a very helpful document because it has a chart of, is salary included in effective salary? Yes, cash salary is. Is housing allowance included? Yes, it is. Are the benefits that you're paying for through us included in effective salary? No, they are not. We do not charge dues on dues. So you've got a chart that should hopefully help answer a lot of those questions. Additionally, if you're totally new to the benefits experience through us, we have any number of interactive videos and webinars on www.pensions.org, just like that decision guide that I had given you the precise address for. But on pensions.org, underneath our education offerings, we have a lot of overviews that will walk you through it. And you can always contact me or 1-800-PRES-PLAN.
Thanks.
So that said, folks, we've gone through the first 2 of our 5 sections already. Congratulations, pat yourself on the back, do some jazz hands, do a little bit of exercise, move around, we're good. And let's jump into plans and programs. This is a graphic of the 4 main categories. Thank you, Joe. Love those jazz hands. This is the 4 main categories that we have for what we offer, and I'm going to go through them section by section. But I'm going to keep this picture up for just a second to emphasize something to you. We've been talking a lot about pastors. Love the pastors. But I don't want to lose sight of the fact that other people power the church. Any employee who gets a W-2 from you can have benefits from you through us. And those benefits, regardless of the number of hours that they work, are dental, vision eyewear, and access to our Fidelity partner for our retirement savings plan. Again, those are dental, vision eyewear, and the retirement savings plan. I don't care if you're working an hour in the nursery. If they get a W-2, they can have access to these things. And you don't have to pay for it. You can pass the cost along to the employee. Benefits are the glue, friends. It says to the employee, we care enough about you to offer these to you. And the employee then says, oh, I care enough to stay with you because you're giving me benefits. It's a really, really good, mutually effective help in the relationship. Now, everything else that you see in this graphic, if you're working 20 or more hours a week getting a W-2 from the church, anybody working 20 or more hours can have any of this. And I jumped up and down earlier about the covenant package. That covenant package, again, anybody 20 or more hours a week can have access to it. So what are the components? Let's dive into medical first, shall we? These are the things that we offer underneath our health and wellness plans. And I promised you a bit of an explanation as to how we actually do this. We are a self-funded plan. That means that we take dues in and we pay claims out. The only margin is administrative expenses. There's not a profit. We are the church. We're doing this to make certain that the church gets what it needs. Now, we do this through our partnership with Highmark Blue Cross Blue Shield and Express Scripts, but we price it so that it is a self-funded plan. We assume the risk, which is why we have to be so careful with the pricing. And how do we do the pricing? Well, Our EVP for benefits, Pat Haynes, any of you have ever met her, she's brilliant. I absolutely love her. She describes it this way. It's 50% science and 50% art. And that gives us the opportunity to try and hit that sweet spot. Any of you are golfers, we're hitting that sweet spot, and we want to make certain that we've got some backup, and that comes from our reserves. Year over year, the healthcare costs are going up. No surprise there. The term of art in this world is trend, and trend is made up of these components. As you can imagine, the unit cost of services is going up. Utilization of services is increasing. That means that the cost share value of these offerings is declining. You can see the trend of our trend. You'll notice it in 2020. We had a negative trend because a funny little thing called the pandemic. And in 2021, people realized, oh, I have deferred all of these elective surgeries or non-elective surgeries. And that's why our trend went up so markedly. We've had now a stabilizing, and you can see our 5-year average. If you go into the marketplace, folks, you'll see that that 7.2 trend is on the low end. That's because we work very hard to make certain that we are setting up baskets to set aside risk. We have high risk claims, we have stop loss coverage, any number of ways to manage that risk and be good stewards of that which you have entrusted to us. Our financial stewardship includes these elements. I'll speak to our coalition purchasing. We are part of the Church Benefits Alliance, and we work to be the 800-pound gorilla negotiating with Highmark Blue Cross Blue Shield and Express Scripts so that we can get the best rates for our coalition and get the contracts that we want. And then we make certain we follow up with our due diligence. That gives us the ability to offer this wide range of special features in this plan, one by one. There's 3 offerings to the coverage. So pastors in those packages get PPO, the gold standard. It means you can go outside of the network. But our EPO offering is still really good. Inside the network, the Blue Cross Blue Shield network covering 96% of hospitals and 92% of physicians nationwide, you can still have really good coverage with EPO pricing. And then finally, high deductible health plan is, as its name would imply, there's first a high deductible before cost sharing kicks in. We have care navigation. We invested in this a few years ago. We're partnering with this excellent entity in Ohio that has a high work ethos. They work in pods, and this pod of 72 dedicated professionals works on our plan and the Lutherans plan. They know it that well. When I had surgery a couple years ago, I was contacted by a nurse from one of these pods checking on me because she knew how scared I was. And ultimately, she made certain that I got the durable medical equipment I needed, the physical therapy that I needed, and then she routed me to her claims management team when the claims started rolling in. So I didn't have the headache. I call these guys my bulldog, and it's really excellent health. And I have the number memorized, but you don't have to because it's on the back of your Highmark Blue Cross Blue Shield card, 855-497-1237. You can be in touch with our folks at Quantum for care navigation. We also have been jumping up and down about mental health. We want to make certain that people recognize that this is a continuing and ever-growing problem. The delay between when people have the onset of symptoms and actually get treatment is growing. It's at this 11-year gap right now. Adults are experiencing mental health crises, and as you've seen in the news, with tragic results, there continue to be an escalating situation for our children. So we know the pandemic made it worse. We recognize that it's been difficult to have access to mental health care providers. So we partnered with Spring Health to provide greater access. Spring Health is an entity that's partnering with Highmark Blue Cross Blue Shield so that we can increase access and bring affordability back into the picture and reduce the stigma. So Spring Health, with its collaborative care team, offers the 6 free mental health counseling sessions for someone who's on our medical plan. And because we've added 6,600 new providers through this mental health network of Spring Health, if you finish with those six, you like your counselor, you can go to the seventh and only pay the $25 in-network copay. The seventh until however many you choose would be $25 copays for each of those visits. Now, that's for what you'd be doing if you went for mental health counseling. Spring Health also has something that is new, coaching, unlimited, free coaching. I can't say enough about this. I personally use it. I found a coach who has a child on the spectrum as I do. She's a pediatrician. She's fantastic. And I see her as often as I can, and it costs me nothing. So we have all these services. We have crisis intervention. We have support for employers. If you've got to have a difficult conversation with an employee, Spring Health with the EAP program also has resources and access for the employer as well. And if we've got critical incident situations, God forbid something happens at your church or we have a disaster, we can bring an EAP team on site. That's the kind of coverage that we partner with. Another value-added feature of our medical program is our call to health. The purpose of this is to lower the member's medical deductible by as much as a third. What do? If you're in our medical plan, you get your annual physical, you enter the date of it, you do a little exercise to know your numbers, like your systolic over your diastolic, your blood sugar. You get 3/4 of the way towards the requirement of 1,000 points to lower your medical deductible by as much as a third. And those last 250 points, such a fun way to do this. Just go in and take a look at some of the activities of what you're already doing. Are you praying for people? You can get points for that. Are you forgiving people? You can get points for that. Are you bringing a healthy lunch? You can get points for that. Click away, and within 20 minutes, you really can find all of those possible ways to get to the place of 1,000 points. And if you want to be a super achiever and go on for another 500 points, we'll send you a $50 gift card. Another 500 points, another $50 gift card. Now we're going to stop at $100. If your spouse is covered and they just do the medical and get to the 1,000 points, we'll send them a $100 gift card. I have my husband do it, and then I have him take us to dinner. Kind of works really well. Call to health. We love it. We also have telemedicine. When our kids were little and they had the inevitable 3 a.m. earache, I'm not trooping out to urgent care that's not open. I'm calling Teledoc because I've already got the app loaded on my phone because I know that it's going to happen to these guys, that they're going to have a 3 a.m. earache when they were little. And it worked beautifully. We have Teledoc. We also have centers of excellence to make certain that if you're having any one of these surgeries and you use a place that has statistically proven better outcomes, you won't have to pay the facilities charges. Now, you're still going to have to pay the anesthesiologist and the surgeon, but you're not paying the facility charges. And if you have to travel, which most of us in the Northeast would not have to travel this kind of distance for a center of excellence. We've got them all around us. We are blessed that way. But if you had to, we would subsidize that travel for the patient and for a trusted person traveling with the patient. We also have a partnership with Livongo to help people manage their diabetes and encourage them to do so. And we also have dental and vision plans. Our dental is divided into DMO and PPO. That is to say, if you want to go out of network for PPO, preferred provider, you choose your provider. The rates are a little bit higher and they're geographically determined. If you stay in network, and a lot of in-network providers are in our DMO, then the rates are a little bit less. It covers these services that you see. And oh, yes, we took advantage of the orthodontia for our kids. It doesn't cover all of the orthodontia, but it sure helps when orthodontia is multiple thousands of dollars. And then we have a partnership with VSP for our Vision Eyewear Plan. And we remember up in the air, Junior Birdman, Vision Eyewear Plan. We have our partnership with VSP for these range of benefits. Now that, friends, takes us back to our 4 categories of offerings, and I'm going to jump very briefly into our flexible spending accounts, our tax advantaged accounts. We partner with Health Equity. And if you're in our PPO or our EPO, you can have access to the flexible spending accounts, the healthcare and dependent care. If you are in our high deductible health plan, you can have access to the health savings account. This gets complicated because it's taxes. So if you've got questions about it, contact me separately. Let's take us back out to our plans and programs as an overview and
We got,
zero in on.
we,
Yes, Jean.
I was gonna say, we got a few questions.
Oh, good. Come.
One is Brenda from Brenda. Does that include a retiree working part-time? And I'm assuming, Brenda, you're talking about an employee working part-time at the church, not a clergy person. Is that correct, Brenda? Yes, that is correct. So if a retiree is working part-time, can they be part, when you said anybody who gets a W-2, does that include in retirees?
That's a great question. Unfortunately, we're not able to do benefits for retirees at this point.
Oh, okay.
Stay tuned, folks. Okay. We're hoping, stay tuned.
Got it.
But right
Okay.
now, if the retiree is working 20 or more hours a week, then they're in a situation called post-retirement service.
Oh, that's clergy. We're talking about non-clergy.
Oh, non-clergy, I'm sorry.
Yeah.
Um, Depends upon their age. Okay. When you get over 65, you get into a situation where is that insurance still good for them? Is it cost effective as opposed to looking at some kind of Medicare wraparound or supplement? Okay. So those kinds of questions when we're at a retiree age, talk to us separately. Okay.
Would they be able to get the vision, the employee assistance, all these add-ons?
So vision and dental could be provided over age 65 if they're retired.
Okay.
Okay. Is that where we're getting at?
If you have more questions, Brenda, contact Carrie directly.
Yes,
Um,
please.
if a pastor has another form of insurance, can they still get dental and vision and
Absolutely.
disability? Yeah. Actually,
Absolutely.
if you're serving a church in our presbytery, they are required to pay that 10%, that pension package. I should have said that. So
So pension, death, and
all
disability,
pastors
temporary
have to,
disability.
yeah, all pastors have to have that pension package. Is what we call it. Can dental, vision, and retiree savings plans be offered without regard to number of scheduled work hours? Does the
Yes.
employee need to work 20 hours per week?
No.
No.
Those three, no hourly requirement. None whatsoever.
All right. Nancy says the options, the PPO, the HDHP seem to be offered to employee pastors, but the cost is picked up by the congregation. How does that work?
Okay, great question. Where can cost sharing happen for our PPO, our EPO, and our high deductible health plan? When somebody gets rates from us for your church, we custom price for the employer because all of this has to be offered through the employer. You can't, as an employee, purchase benefits independently. You have to have them through the employing church entity. When a church requests rates for their medical eligible population, we prepare a matrix of 12 prices, and they are done annually and monthly, so you can see that cost breakdown both ways. Imagine up here, these matrices are the PPO, the EPO, and the high deductible health plan, three kinds of coverage. And then the types of coverage, member only, member and spouse, member and children, or full family. So that is going to give you 12 boxes for those 12 different prices. And what we say is the minimum cost sharing, the employer has to pick up 50% of the lowest cost option. So if you're looking at these 12 prices, the high deductible health plan is going to be the least expensive. High deductible health plan, member only coverage is going to be the least expensive of the 12 prices. And we say that the employer has to pick up 50% of that. But if the employee wants full family PPO coverage, the employee can pay for the difference. The employer picked up member only high deductible health plan. The employee can pay the difference to buy up essentially the coverage that they wanted. And remember, medical is available to non-pastors. Just the requirement there is you have to be 20 or more hours a week. And if that answered the question, great. If anybody needs me to clarify or come back,
Nancy says that was, thank you, question answered.
beautiful.
All right, that's all we got.
I love it. Y'all are great. Hang in there with us, okay? We are doing great on time. I'm going to speed through a little bit so I can get to the employer agreement for you folks, but we're still good. No worries. Let's take us back into the death, disability, and life plans. You see these offerings. I'm just going to summarize really quickly because death and disability is what's part of those CPP and TPP packages, has these lovely possibilities. Remember, all these slides are coming to you as a PDF. Temporary disability is a different offering. Again, it's part of the CPP and the TPP and the covenant package. It's that 7-day waiting period to the 89th day. Core disability or long-term disability picks up at the 90th day and goes until the physician says you're medically able to do the job for which you were hired again. The temporary disability is that. Long-term disability can be offered as a standalone. That is to say, if you've got a non-pastor who's not in one of those packages and they just want 90-day or more coverage, that's what this is. We offer term life and accidental D&D. AFLAC, term life and AFLAC. And then we have supplemental death benefits for the member, the spouse, and the children. I ran through it. I apologize. I can come back to it if you need me to. Let's jump to our retirement programs. We are the Board of Pensions. We specialize in our pension. Our defined benefit is our hallmark. You can see some of the stability that we have. You can also see that, remember I told you about accruing benefits at the median effective salaries for 2025 are 70K, and in 2026, it's going to be 71.1. So if you've got an employee who's earning $40,000 for their full-time pay, that's their effective salary, and you put them in the covenant package or you purchase pension credits for them at just 8.5% of effective salary, they're going to earn pension credits this year on 70K, not the 40K they're being paid. It's unheard of, folks. Plus, there's the boost of experience apportionments that's awarded, assuming we're doing well. And as you can see, this comes 100% by the employer. An employee cannot purchase their pension credits. Our retirement savings plan is a defined contribution plan. It works just like a 401k does with voluntary salary reduction. We partner with Fidelity for this. You can see that we've had a growing participation in it. And we have, for employees and employers, a very reasonable cost situation. And for employers, you don't have to file a 5500. 12 funds. And if you want to have more of a brokerage relationship, you have that access to Fidelity. You just pay for that privately. This is the value-added sections, folks. We have in our assistance program 10 different grants. These are the 3 for anybody, that is members, retirees, and surviving spouses. These are the 2 for pensioners only, both income and housing supplements, and then the retiree medical for hearing aids and dental work, because a lot of Medicare programs don't cover that. And then we have 4 grants for minister members only, 2 for debt relief, and 2 for overall pastoral health, Sabbath sabbatical, and clergy wellness. This is an eye chart that tells you that we've given away in 2024 $10 million through our assistance program. And we want to keep giving away more. Our assistance team is looking for ways to do that. So please, if you've got a pastor or a member in our plans, as long as they're in any of our plans, even just the retirement savings plan, they have access to the emergency assistance grant for up to $5,000 for emergency situation. We want to be able to do this for people. We have lifelong learning through the Arc of Ministry. Credo as many pastors will tell you, is a 7-day step away from everything. And they get to look at those 4 pillars of wholeness that we talked about at the beginning with the theology of benefits. And Credo used to be one and done. We're now working towards creating multiple Credo opportunities throughout the life of a pastor's ministry. We also have online webinar offerings and in-person seminars like our clergy wellness retreat that just took place down in Montreat and happens every August. Employer agreement season, as I shared with you, started last Thursday. It's going until October 3rd. And it's really important for, if you're the employer representative for your church, to look on Benefits Connect at what you have said you are willing to offer to your employees, make any modifications, make certain that somebody's effective salary is up to date so that they're getting the proper pension credits that they deserve. Make certain that happens by October 3rd. These are the steps. You want to make certain that you're going to your current offerings and seeing what's there. Talk amongst your finance folk, your personnel committee, confirm what's going to happen through the Benefits Connect. And if you've got any questions, there is a webinar being offered at 2 p.m. on the 16th and the 25th of this month that goes through how to handle the 2026 employer agreement season. That's available. The link is right on the top of our lead article on pensions.org right now for that new webinar to walk you through the employer agreement season. Annual enrollment, I try to differentiate for people. Employer agreement is yay. That's when the employer goes in and says, this is what I'm going to offer. Annual enrollment is AE. It is the time when the employees go in and say, oh, of the basket of beautiful things that my employer is going to offer me, this is what I want. And that is the 3 weeks around Halloween, before Halloween, up to the Friday before Veterans Day. That's our typical season, 3 weeks for annual enrollment around Halloween. This is how you get in touch with us. As I said, Jean's going to have this PDF. This is what we do. And I'm so glad that you let me be here. I'm going to stop sharing.
We have another question. How do you do an employer agreement if you get a new pastor after 10/3, after
Okay.
the open enrollment?
Great question. Anytime you have a new employee, pastor or otherwise, you're not constrained by our employer agreement season. You've got a new hire or a new fire of any kind, you can make those changes at any point by being in touch with my colleagues at 1-800-PUZ-PLAN, 1-800-773-7752. They are more than happy to assist with adding or taking somebody out of any of our plans.
Next question. If a pastor desires to opt out of the Board of BOP provided coverage to become part of a spouse's plan, did I hear correctly earlier that requires approval of the COM? Yes, as long as they're not installed, they can opt out of the medical part. That you still have to be providing the covenant plan, the benefits piece of it. But yes, they can. And your pastor got approval last year. There's no reason to think you need to do it this year. So I know the situation. So yes, if the pastor opts out for their spouses because they're not installed, they can do that. And it does have to have Board of Pension, or it's the one of the people from the Board of Pensions COM team does that. You don't have to go before the whole COM. But if it was already approved, it does not have to be approved the next year. But you do have to put in your terms of call that you had previous approval and your pastor is covered by their spouse's insurance. So there'll be a place on the form to do that this next year. Right, Joe? Just a thumbs up, right? Yes, okay. Next question is, does the employer agreement depend on terms of call?
So the employer agreement, from our point of view, does anybody remember the Mission Impossible scene where Tom Hanks is having to go through that room with all the laser beams, and he's kind of, doing the pretzel to get himself through that. That's how I think about doing um, terms of call, because you've got one laser from the presbytery, you've got one laser from the Book of Order and our Constitution, you've got one laser from what the Board of Pensions requires, you've got another laser from the Social Security Administration, and you've got another laser from the IRS, right? How do you get through all of this? So, are the terms of call the employer agreement? They are a big component. The employer agreement is a big component of the terms of call. Employer agreement season operates separate from whatever calendar your presbytery has about when those terms of call are due. And as was made clearer earlier, if you're hiring somebody outside of whatever regular calendar there is for any of these laser beams, because it's a new hire, it doesn't have to be constrained by any of the laser beams requirements. Does that answer the question? I sure had fun with it. I don't know about you.
Other questions? The one thing I'd like to point out to Highlands people, or Highlanders, as someone called themselves the other day, to the Highlanders, um, is the spring health program. Uh, it if you're a pastor, sign up, get onto it, sign up for it. If you're an personnel or session member, or you're the employer representative, encourage your staff to participate. I During the pandemic, as Presbyterian leader, I knew what was going on with all the pastors, kind of thing. It was a hard time. And a lot of them were trying to take advantage of the Board of Pensions 6, and I think they were offering 10 at that point, free
Yes, we offer 10.
counseling. And it was so hard to get a therapist or someone to help them. Um, and some of our pastors did not make it through the season and left ministry. I don't want to see that ever happen again. So encourage your pastors to use this program. It is excellent. It's important. Um, Even if they're saying, no, I'm fine. Yeah, but there are stressful seasons. There are in life, and sometimes just having one or two appointments can help you get through that stressful season. So I just really applaud the Board of Pensions for coming up with that, because we needed it during the pandemic in the worst sort of way. So it's there. Encourage your pastors to use it, your employees who qualify, and pastors, you take advantage of it, especially the coaching. That's cool.
Great.
Seriously. Um, um, Joe's question. For a new pastor beginning now, what type of AE is necessary or appropriate?
I'm sorry,
AE, what's the AE, Joe?
annual enrollment?
And annual enrollment. Okay, thank you. What
I'm going to
type,
get you done.
sorry, EA.
Oh, what
Someone,
type of employer agreement is appropriate?
okay.
So for a new pastor doing an employer agreement, the employer representative has to go in and create the employer agreement, which most easily accomplished. Don't feel like you have to stumble with Benefits Connect. If you are the employer representative for any employing entity, call my colleagues. They walk people through this every day. We've even started a new callback feature on our phone tree. So if you know that you cannot wait online, and we make certain that our online time, our waiting times are really minimized. But if you know you can't wait, you can say, I want to call back. And that will happen. We'll have somebody reach out to you. But have our team walk you through screen by screen what you need to do with your employer agreement. Does that answer the question?
Mhm.
Okay.
Any other questions? Well, then thank you, Carrie, for
Yeah.
getting us within the hour. Very good. Um, and thank you all for coming out again for another one of our webinars. If you're in the Financial Sustainability Project, we have one more webinar, and I know we had promised a couple more. We've just run out of time. But we may offer them after October, just because we just couldn't schedule them. So that is September 17th. That will be on stewardship and your stewardship campaign. Uh, um, Stephen Kaiser from the foundation will be with us. He volunteered, and I was like so excited. He said, I'll do it. I was like, cool. Um, and then October 11th, which is a Saturday, uh, we will have our closing event for all of those who are in the Financial Sustainability Project from 9-ish, 9:30, but you can come at 9 for uh, fellowship time until noon at the Chester Church where we started. We will be meeting there, and um, we have two guest speakers. One is Cy Hughes, who is with the Stewardship and Funds Development. They just changed their name. And he will be coming talking about how special offerings are part of that storytelling that we do in the church. And then we hope to have, we're working it out. We hope to have Brad Masters from New Covenant Trust to be our other speaker. And we'll have some big chunk of time for you all to share what you learned, talk to each other, have some small group time to uh, finish up, and then we'll have some sort of evaluation, because this project that we've been working on, which sometimes feels a little chaotic because it has been, because no one's done this before, is going to be part of the pilot project that is starting January, February of next year for the whole denomination. And we are in the time recruiting. We're hoping to recruit 20 presbyteries to participate as part of that, changing the funding model of the whole denomination. So it's a big picture kind of thing. But that have been part of that pre-pilot. We've been learning from you. And so on October 11th, we'll also have some evaluation, asking you some questions to help us learn what to do at the next level. So I hope you can all be there. The registration for that should be coming out the next couple weeks for you to register to come to the October 11th at Chester Church. It's in person. There is no online component to it. So you need to come in person. Any questions one last time? Well, thank you, everybody. Carrie, can I ask you to close us in prayer?
I'd be honored. I love Highlanders. I'm so grateful to all of you for being here tonight. Please join me in prayer. Gracious and loving God, you are ever with us, even when we are scared or feeling any other emotion that might in any way cloud our view of you. You are that constant in our lives. And so we are grateful for the ways that you show it to us and demonstrate to us our connectivity, not just across the stars, but across time and space, so that we might prove that benefits can be made for everyone in these relationships. Lord, you know those things that we've said or left unsaid, done or left undone. You know the people and the situations that are closest to our hearts. We thank you for having freed us from guilt about those things and made it such that we can put our feet on the floor each and every day, recognizing your goodness. Go with those who need your extra help. Be with us as we light the way for others. We pray this in your son's mighty and saving name. Amen.
Amen. Thank you, everybody.